Yeah. Well, what I know I got it, niggas say nah. Yeah. Check it.
If you need that one-on-one doc connection, hit up my private doctor on Telegram for consultation perfection. Links in the description, come through for a private session. Osteoarthritis, we call it OA, chronic degenerative joint disease. Yeah, cartilage fades away. Underlying bones taking hits, most common progressive joint disease. Also known in the streets as arthrosis, now let me break it with ease. Peep the list, here's who's at risk. Mostly elderly, they can't dismiss. Female sex, we see it more. Obesity adds stress that joints can't ignore. Lack of osteoporosis, inverse relationship that's odd. Occupation with joint stress, heavy loads the guard. Previous joint injury leaves the door ajar. Muscle weakness can't support who you are. Genetic predisposition, you inherit the scar. Where does OA hit? Let me count the spots, cervical and lumbar spine. Feel it in your back knots. First palm of the carpi, joint of the thumb, proximal inner phalangeal. Yeah. Boot charts, nodes come, distal inner phalangeal. Yeah. Joints, habitants, nodes say yo. Hip, knee, subtalar, first metatarsophalangeal. Big toes in the flow. Uncommon but possible, shoulder, wrist, elbow, MCP. Joint still show. Joint pain worsens with activity, rest brings relief. Morning stiffness, 30 minutes, quick thaw, belief. Crepitus on movement, that creak and grind. Bony enlargement and tenderness you'll find. No big warmth, no systemic inflammation to explore. Just those bony nodes on fingers, hibitin and Bouchard at the core. Monoarticular arthritis versus polyarticular disease. We break it down, let's put your mind at ease. Acute OA, a vascular necrosis, crystal arthropathies, septic arthritis, trauma-related pathologies, syringulative spondyloarthropathies, reactive arthritis, malignancies rare, keep it tight, that's the thesis. Fibromyalgia, juvenile idiopathic arthritis, Lyme disease, regular OA, psoriatic and rhinitis, rheumatic fever, serum sickness, viral arthritis, pharyngeals lined up, no oversight. Check the typical clinical findings, we know the score. Radiographs show joint space narrowing, osteophytes galore. Subchondral sclerosis, cysts like hitting doors. Age usually over 50, marker for the war. No systemic inflammatory markers, labs stay low. That's the evaluation flow. I'm pharmacological. Weight loss, get lean, ease the load on your frame. Physical and occupational therapy, exercise the game. Heat cold therapy, alternate flame to tame. Pharmacological, soothe the skin. Oral and acetate, hit deep within. Acetaminophen, Tylenol, keeps the pain thin. Topical capsaicin, spice up the wind. Steroid injections for flare-ups when they begin. Tramadol for strong pain control, prescribed. Surgical arthroscopy, limited routine benefit. Osteotomy, young patients with malalignment split. Arthroplasty, joint replacement when all else quits. Joint fusion, arthrodesis, for relief when motion's not the hit. Most managed outpatient, primary care in sight. Surgical referral if severe pain or functions uptight. Always the silent breaker, treat it step by step right. Keep those joints moving, bring your quality of life to light. That's your OA rap, now you're in the know. For private consults, my private doctor's the way to go. Link in description, hit the chat, let your questions flow.